Now we will discuss the gastric diseases medications. The first group we will discuss is antacids, and according to its name, it is a base that will interact with the excess acidity inside the stomach, and it will relieve the symptoms such as heartburn. As we know that the normal range for the normal pH in the stomach is between 1.5 and 3.5. So whenever we go lower, or whenever there is more acidity, we will have the feeling of heartburn or any kind of stomach pain. So adding a base, it will interact with the acid and neutralize the acidity. As we can see, antacids, it's highly safe and can be used easily, but at the same time, we have to make sure that we avoid taking it with other medications within 2 hours, because it will reduce the absorption of them, especially tetracyclines, fluoroquinolones, itraconazole, and iron, because the presence of the base will affect the absorption of these medications. وهذا إشي كتير مهم نخبره للكاستمرز، لأنه الناس بالنسبة لهم الأدوية الحموضة هي أأمن أدوية ممكن استخدامها بكل الأوقات، فضروري ننبه على هاي المعلومة. بالنسبة للأدوية أو العلاجات الحموضة اللي موجودة بالصيدلية، they differ according to the composition. They differ in the salt in the bases inside of them. We have ENO, which is sodium carbonate, TUMS واللي هو nowadays popular هو calcium carbonate. We have RENE, which is calcium carbonate with magnesium carbonate. And we have فوار fruit and فوار lemon, which contains sodium bicarbonate as a base, and it contains weak acids اللي هم citric acid and tartaric acid, and they are really good for the digestion process, and that's why it gives good feedback. If we have any antacid that is containing magnesium salts, such as RENE, usually the magnesium salt may lead to osmotic diarrhea, because it will give magnesium oxide واللي هو it works as laxative. Whereas if we have any antacid that is containing aluminum salt, it may cause constipation, and that's why we used to have antacids that are containing both salts together, or both magnesium and aluminum in the same medication, to cover the side effect of each other. Every time we are discussing antacids, بيجي معاه something parallel, واللي هو we need to discuss Gaviscon. Gaviscon, we cannot call it antacid. يعني as a matter of fact, it is usually classified as reflux suppressant. Okay? The mechanism of action of Gaviscon is really clear. It contains sodium alginate. Sodium alginate, when it reacts with the acid, it will form a covering layer, a protective layer, that will prevent all the acids to get out of the sphincter to the esophagus. انتوا دائما بتشوفوا دعاية الجافسكون كيف انه هو بيغلف المعدة، بس هو فعليا زي ما احنا شايفين، هو لما يتفاعل مع الاسيديتي رح يعمل هاي الطبقة الفومي. اوكي، وهذا الفوم رح يمنع كل الأبخرة والحموضة انها تطلع وتشعر المريض بالانزعاج. طبعا we have to always remember that it's not only sodium alginate واللي هو main active ingredient واللي هو main reason for classifying it as a reflux suppressant, but plus the alginate we have sodium bicarbonate and calcium carbonate. So it does have an antacid activity. Another medication we have that it helps in the relief of these symptoms is etopride. Etopride is the active ingredient for Ganatone or Etalon we have in the market. It works for dyspepsia. It works for the feeling of heartburn, for the nausea feeling. The indication for this medication is related to the mechanism of action. What etopride does is that it activates the gastrointestinal motility, but it works only in the upper gastrointestinal tract. So it has a high safety profile and it's really effective. رح تشوفوا انه المرضى كتير بيعتمدوا عليه. فور اكزامبل برمضان الشخص اللي بيكون صايم فترات طويله وبياكل وجبه دسمه ممكن يشعر بالتخمه والاندايجيشن. So it's really effective. It can be used for people with dyspepsia. It can be used for GERD patients and for peptic ulcer patients. هو رح يغطي جزئية الأعراض، الشعور بالتخمة، الشعور بالغثيان، الأعراض اللي هو بيشكي منها المريض واحدة من هاي الأمراض. So it can be combined with the other medications. As we mentioned, it is specific for the upper gastrointestinal tract. So هو ما له side effects. It has high safety profile. And you can take it before your meal and will be highly effective. اوكي هلا ثالث جروب بدنا نحكي عنها اللي هي ال H2 antagonists. When we discuss H2 we are speaking about histamine 2 receptor antagonists which present in the GI tract. The histamine receptors present in the parietal cells, which are responsible for the proton pumping. As we know لما يصير في pumping لل H+ راح تزيد الأسيديتي بمعدتنا أو يقلل pH. Okay, so if we block the histamine receptors we will stop the proton production. The H2 antagonists are highly safe. The main side effect is due to the long-term use. Prolonged use of H2 antagonists will lead to B12 deficiency. Okay, now we had in the market actually ranitidine, and it was recalled because a high concentration of an impurity named NDMA, which is carcinogenic, was available in the ranitidine products, and that was the reason for a recall in 2020. Okay, so the only H2 antagonist we have now in the market is famotidine, which is Famodar. We have Gastrifam, Acifam, Beptifam. Okay, as we mentioned, it is highly high safety profile, and it is a category B for the pregnant. وهذا إشي كتير مهم نعرفه لأنه one of the reasons of the heartburn هو pressure in the case of pregnancy. We have new idea in the market to treat GERD using non-medical formulas. One of these examples is GERD-OFF, which contains hyaluronic acid or hyaluronate and chondroitin, and this will protect the mucosa and promote the healing process. Okay, also it contains an antacid inside of it, and this will work on the acidity. The other product with the same idea, with the same medical device idea, is fast acid relief, okay, which contains a mucopolysaccharide. In the same way, it will protect the mucosa, promote the healing process. Also, it contains an antacid inside of it. Okay, now we covered the heartburn medication and the GERD medication. Now we will discuss the H. pylori treatment. H. pylori, as we mentioned, it is a bacteria that grows in the stomach, and it will lead to the ulcer. Okay. The first thing we need to understand is how to diagnose H. pylori. موجود عندنا بالأردن ممكن يكون عن طريق blood sampling أو stool sampling أو حتى بالاستنشاق. هلا بالنسبة للبلد sampling هو بيعطينا antibodies, so it will indicate if I ever had an H. pylori infection or not. فبالتالي هو مش indicative إنه أنا عندي ال H. pylori هي active حاليا. So we will recommend that the patient will undergo a stool analysis. يا إما بيعمل stool analysis or عن طريق البريث رح يقدر يعرف الطبيب إنه هذا المريض عنده H. pylori. هلا ال H. pylori زي ما حكينا إنها هي بتعمل defense لحالها, and that's why one antibiotic أو one medication will not be enough. فالguidelines تعطينا regimen للtreatment of H. pylori. The first line therapy احنا بنسميه triple therapy, إنه يكون عبارة عن proton pump inhibitor with 2 antibiotics. Okay. If it was resistant أو if the treatment was not effective بنروح على second line treatment اللي هو بيكون فيه 4 medications. We will discuss the H. pylori treatment in the antibiotic lecture إن شاء الله. But in this lecture we will cover the PPIs and the bismuth that is a part of the treatment regimens. Okay, so discussing the proton pump inhibitors, in the PPIs we will be working on the pump itself. فإحنا مباشرة بنشتغل على acidity production بالstomach. So it can be used for any kind of ulcer or any kind of peptic ulcer with NSAIDs and for the treatment of GERD. وزي ما اتفقنا إنه in case of NSAIDs we need to recommend PPIs for the patient to prevent the ulcer formation. فبالتالي the most important thing about PPIs that can be used for treatment and for prevention. They have a long duration of action. It works more than 24 hours, and so you can take it once daily. They should be given before meals. يعني دائما بننصح المريض انه ياخذ حبة البي بي اي الصبح على الريق وبعدين يمارس حياته بالشكل الطبيعي because this pill will prevent any kind of symptoms. Okay, we have omeprazole, esomeprazole اللي هو النكسيوم المعروف. We have lansoprazole, dexlansoprazole. المميز بالديكسلنت انه can be taken regardless meal هو والرابيبرازول الباريات. Okay, and we have pantoprazole. The differences between the PPIs بتصير فروقات بيناتهم على الافيكاسي on the let's say NSAID associated ulcers, على ال FDA pregnancy category. Okay, but they are all effective and they are active in the market. You can find multiple, we have a lot of بدائل. And we need to understand that although it is highly safe, all the PPIs are very safe, but they will lead to long-term use of them. It can lead to osteoporosis, to anemia, and to low levels of magnesium. And this is important to be highlighted with the patients. The last group of medications that we will discuss is bismuth salicylate. Okay, bismuth is an anti-inflammatory agent. It will work on the nausea, the indigestion, the upset stomach, even on the diarrhea. So it will cover all the symptoms of the GI tract. Okay, and its job is to protect the mucosa. It is a mucosa protective, and that's why we have it in the guidelines and the treatment of H. pylori. Helicobalance contains strains of probiotics, and it will work on in the case of the H. pylori because it has active strains, and there is a lot of studies discussing the usage of the probiotics in the treatment of H. pylori.